Michael, once an active man, has been living with a neurological condition. Swallowing has become increasingly difficult, making mealtimes challenging. His family and he are worried about his loss of weight and weakness. His doctor explains that advanced neurological conditions, such as motor neuron disease, Parkinson's, and stroke, can cause swallowing difficulties, leading to malnutrition and dehydration. His care team recommends tube feeding so he can continue receiving adequate nutrition. There are two types of feeding tubes, NGT and gastrostomy. An NGT, or nasogastric tube, goes through your nose and down to your stomach. It needs changing every 4 to 6 weeks, and the tube is visible on the face. A gastrostomy is different. It's placed through your belly directly into your stomach. It's a long-term solution, needing changes every 6 to 9 months, and sits discreetly under clothing. Here's what sets them apart. NGTs are quick to place but need frequent changes and can be uncomfortable. Gastrostomy is a procedure that provides a more secure and comfortable option for long-term use. Your doctor will recommend the best option based on how long you need feeding support. Together with his family and healthcare team, Michael discusses his options. They talk through the benefits and risks, making sure that Michael's wishes and questions are heard. The two main methods for long-term tube feeding are percutaneous endoscopic gastrostomy, or PEG, and percutaneous radiologically inserted gastrostomy, or PRG feeding. Tube feeding placement involves some risks. Your healthcare team will assess your individual situation and discuss potential benefits and risks before proceeding with any intervention. Some possible complications after tube placement may include infection, minor bleeding, or issues with tube function. While rare, more serious complications can occur. Your healthcare team will monitor your condition and take appropriate precautions to minimize risks during and after the procedure. Michael is scheduled for a radiologically-guided gastrostomy. Unlike traditional approaches, this minimally invasive technique uses X-ray imaging to safely place the feeding tube for patients with impaired breathing. Michael arrives at the hospital. He receives instructions not to eat before the procedure. His medical and respiratory team explain and initiate non-invasive ventilation to support his breathing. No food or drink is allowed a few hours before the procedure with adequate bowel clearance. Blood is taken for further checks. The patient will be transferred to a procedure bed. An ultrasound scan will help to locate the position of the stomach. A nasogastric tube will then be inserted temporarily as part of the procedure. Using local anesthesia, the radiologist numbs the area on Michael's abdomen. A mask delivering gentle air pressure is used to assist in Michael's breathing, and some light sedation will be given. During the procedure, temporary gastroplexy buttons are placed to secure the stomach wall. An incision is then made to create a small opening for the gastrostomy tube. A small balloon is inflated to anchor the tube in the stomach.
The gastrostomy tube will be used for daily tube feeding.
Michael is monitored closely as he wakes from mild sedation. As the tube is minimally invasive, most patients recover quickly. With training from nurses and dietitians, Michael and his caregivers learn how to keep the site clean, prepare nutritional feeds, and troubleshoot minor problems. Michael can now receive water, nutrition, and medications he needs at home. The decision about having a feeding tube is deeply personal and should be based on individual circumstances, values, and goals of care. Your healthcare team can provide guidance and support in making informed decisions about nutritional support options. If you have questions or need support in making healthcare decisions, please speak with your doctor or healthcare team. They can provide detailed information specific to your situation and discuss available care options.